Okay, your patient is crashing. You get an ABG and suddenly everything looks like chemistry class. Trust me, there's pH, there's CO2, there's CO3. You're like, what is going on here? But hey, ABGs are actually one of the easiest things in nursing. Just give me your ears. I'm going to make it so simple, you will never get it wrong again. First and foremost, you need to know your normal values. Trust me, they are non-negotiable. You need to memorize it. Your life depends on it. So you need your pH, which is 7.35 to 7.45, your CO2, which is 35 to 45, and your HCO₃, your bicap, which is 22 to 26. That is it. That's your foundation. So quick trick. pH tells you overall condition. Your CO2 deals with your lungs, that's respiratory, and then the CO3 deals with kidney, that's metabolism. So at least get this foundation. You need it. If you don't have this foundation, then there's a problem. So now that we know that foundation, we need to know, is it acidic or alkaline? So look at the pH first. pH, is it less than 7.35? It means it's acidic. Is it above 7.45? It means it's alkaline. Don't overthink it. It basically tells you, is the patient acidic or alkaline? Now that we know all that, we need to find out who is causing it. And this is where people panic. But here is the trick. Okay, so guys, this is just a visual of all that I was talking about. Okay, so this is your pH. It is 7.35 to 7.45. Your PaCO2 is 35 to 45. And then your HCO₃, or your bicap, is 22 to 26. Now, the trick here. Once you get an ABG question, this is what I want you to do. As I said earlier on, these values are not negotiable. You need to know it because that is going to be your foundation. You need this to build on it. If you don't know the foundation, if you don't know the basis of this, then you're going to have a problem with ABGs. So please memorize this. Now that if you finish memorizing it, this is what I want you to do. I want you to start labeling them. That's funny, hey? What do I mean by start labeling it? I want you first write it in this order. So you have your pH, your CO2, and your CO3. Okay, write it as 8 in this order. Now let's label it. So you first start AB, BA, AB. You might be like, Med said decoded RN, it's crazy. No, I'm not crazy. Or you might be thinking, are we in kindergarten or grade 1? No, just relax. I'll explain to you why AB. So A stands for acidic. B is your basic. That is all that it means. Okay? So if you have a pH of less than 7.35, it makes it acidic. Okay? If you have a CO2 less than 35, it makes it basic or alkaline. Okay? So that is basically what I mean by AB or labeling it. Now we know that CO2 deals with the lung. Because when you hear CO2, what comes into your mind? Exchange of gas, right? Where does exchange of gas happen? In your lungs. When does it happen? During breathing, during respiration. Okay, so that is about CO2. And then you have your CO3 that deals with kidney and then metabolic. Okay, so one nice thing is in ABGs, kidney and lungs, they treat each other good. If one is in trouble, one steps in. You know, just like how we have to do in normal life. If your friend is in trouble, you have to step in and help, right? So that is basically what they do. So now, one thing you need to remember, what matches your pH is always what the problem is. What do I mean by that? So let's say you have a pH of 7.34, right? 7.34, making it what? Acidic. Okay? And then you have a CO2 of, say, 48. making it also acidic. Okay, if they are opposite, if your CO2 is, if they are the same, if they are matching, it makes whatever that is matching your pH the problem. Okay? So we always have to start with the pH. We have to figure out, is the pH acidic or basic? Right? When we figure it out, then we have to ask ourselves, what is the problem? Is it the CO2 that is matching the pH, or the CO3 that is matching the pH? Because that is what is going to help us know what the problem is. Now, when we figure that out, we have to find out, did whoever that wasn't the problem do anything to help out? So that is what we term as the compensation. Did it try to do anything? Did it go up? Did it go down to compensate for what is going on, or it stayed normal? Okay, so that is when we have a fully compensated, partially compensated, or uncompensated. If it stayed normal, or the other one that is not the problem, if it stayed normal, it means it is uncompensated. Okay, but if it went up or down, abnormal from its normal value, then it is partially compensated. But it only becomes fully compensated when the pH is within normal, meaning when the pH is 7.35 to 7.45. Okay? So, hope you get this. All right? Let's continue. Okay, let's look at an example here. We have a pH of 7.48. Now, what is it telling you? A pH of 7.48, remember, if we are doing AB, is going to be what? Alkaline, right? Or basic. Okay? Now, your CO2, which is 48. Remember, your CO2 normal value is 35 to 45. Okay? 48 makes it what? Acidic. Okay? So it is acidic here. Let me actually use a red pen here. So this is acidic, and this is basic or alkaline. Okay? Now your HCO₃, remember, it is 22 to 26, right? But it is 30 here. So what is it going to be? Remember, if we are labeling it, it is AB. Okay, your HCO₂ is the same as your pH. Okay, it goes in the same direction. Okay, so it's going to be, so 30 is going to be what? Alkaline. Okay, so it's going to be alkaline or basic. So when you look at this, which of them is matching your pH? Is your CO₃. So then we know it is going to be a metabolic issue. So metabolic, it is what? Basic. So metabolic alkalosis. Okay. Now the CO₂, the normal CO₂ is 35 to what? 45. But here it is too high. So it means it's doing something. It's compensating in some way. So it's going to be metabolic alkalosis, partially compensated. Okay? So that is one example. Now let's look at the second example. Your pH is 7.30. So 7.30 is making this pH what? It's making it acidic. Okay? Now your CO₂ is 50. Remember, your CO₂ is 35 to 45. Okay? So 50 is also making it what? Too acidic. Look at your CO₃. It's normal. because your range is 22 to 26. So this is actually normal. So now the problem is respiratory issue because the CO2 is matching your pH. They are all both acidic. So then we are going to solve it as respiratory acidosis. This is not doing anything to help. So it's going to be respiratory acidosis uncompensated. And that is it. Okay? Good. So you need to try so many examples in order to perfect yourself. Okay? Good. So that is it. You just mastered ABGs. I hope this really helped you. Okay? Well, if it did, subscribe to my YouTube channel, Med Surg Decoded RN, where I break down complex nursing issues or diagnoses to simple ones. Okay? And you know what? Drop ABG in the comments and I will send you a cheat sheet. Okay?